Ladies, if you're waking up tired, feeling groggy, or worse, getting elbowed by your partner because of your snoring, this video is for you. The truth is, many older women snore. And no, it's not just a man's problem. But what's really shocking is how often it comes down to a few bedtime mistakes that you're making without even knowing it. So stay with me until the end, because I'm going to reveal 6 bedtime mistakes that are silently ruining your sleep and making snoring worse as you age. While you're here, be sure to like this video, subscribe, and comment below with your biggest bedtime challenge. Is it snoring, insomnia, or something else entirely? Let's dive in. 1. Sleeping on your back. Ladies, let's talk about the queen of all snoring positions, lying flat on your back. Now, I know, for many women, especially those of us with joint issues, sleeping on your back might feel like the most comfortable position. After all, it takes pressure off the hips, the knees, and even the shoulders. But here's where it gets problematic, especially after a certain age. As we get older, the muscle tone in our throat and neck naturally weakens. That's not a flaw, that's biology. But when you lie on your back, gravity has full control. Your tongue, soft palate, and even the tissues in the upper part of your throat tend to collapse backward. And what does that do? It narrows your airway, sometimes even partially blocks it. And that creates the vibration we hear as snoring. Even if you never snored before, this change in muscle tone postmenopause, combined with back sleeping, can suddenly turn you into a nighttime noise machine without you even realizing it. And let me be blunt. Back sleeping can do more than make you snore. It can increase your risk for obstructive sleep apnea, which is a serious sleep disorder that affects everything from memory and blood pressure to heart health. So what's the fix? Simple. Side sleeping. You can try hugging a body pillow, placing a tennis ball behind your back, or using a wedge pillow to gently tilt your body. It's a small change with massive impact. 2. Drinking alcohol in the evening. I know some of you are thinking, but I only have 1 glass of wine, and it helps me fall asleep. Trust me, I hear this all the time. And yes, a little wine or a nightcap might feel relaxing in the moment. But here's what's really happening once your head hits the pillow. Alcohol acts as a depressant. It slows your brain, your breathing, and critically, it relaxes your throat muscles. This might not sound so bad until you realize that overly relaxed muscles in your airway are a primary cause of snoring. They collapse more easily, which causes the tissue to vibrate when you breathe. That's your snoring. And often, it's worse after drinking. Here's the kicker. Alcohol also disrupts your sleep cycles. So while you may fall asleep faster, your sleep becomes shallower, more fragmented, and less restorative. You may not even remember waking up multiple times, but your body does. That's why you might still feel groggy in the morning, even after what seemed like a full night's rest. And for senior women, there's an additional layer. Our metabolism slows down with age. So alcohol stays in the system longer, increasing its effects, especially if you're on medications or managing chronic conditions. If you're dealing with snoring or poor quality sleep, I challenge you to try going alcohol-free in the evenings for 1 week. Just 1 week. Your partner may notice the difference before you do, but you will feel it. 3. Taking sedatives or sleep aids unknowingly making it worse. This one is a quiet troublemaker. And I want you to pay close attention because many women have no idea this is happening to them. Let's say you've been having trouble sleeping, which is incredibly common in our later years. Maybe your doctor prescribed a mild sedative, or maybe you take an over-the-counter sleep aid, or even just a nighttime cold medicine. What's the harm, right? Well, here's the ugly truth. Most of these medications work by depressing the central nervous system. And just like alcohol, that means they also relax the muscles of your throat and upper airway, often more than your body can safely handle. What happens next? As you drift off, your airway starts to collapse in on itself. This doesn't always cause full-blown sleep apnea, but it does increase the likelihood of snoring, sometimes dramatically. Even medications like antihistamines, which are often marketed as sleep aids, or benzodiazepines for anxiety can create this effect. And because your natural muscle tone is already reduced with age, the risk is higher for senior women. But here's what makes this worse. These medications can suppress your body's natural arousal response. That means if you stop breathing momentarily in your sleep, which can happen with snoring or mild sleep apnea, your body might not wake up like it's supposed to. You stay in this half-suffocated state longer, and you wake up exhausted without understanding why. If you're relying on sleep aids regularly and snoring has become a problem, it's time to reassess. I'm not saying stop cold turkey. Never do that without speaking to your provider, but you do need to have a conversation with your doctor. There may be safer alternatives like cognitive behavioral therapy for insomnia or even natural supplements that don't impact your airway. Don't let your sleep aids turn into sleep saboteurs. 4. Eating too close to bedtime. This one's sneaky, and it's probably happening more often than you realize. Picture this. You've had a long day. You finally sit down to dinner around 7:30 or 8 p.m., and afterward, you treat yourself to a little snack, maybe some chocolate, a few crackers and cheese, or even a small bowl of ice cream. You think, what's the harm? After all, you're just going to bed soon. Here's the harm. When you eat too close to bedtime, your digestive system is still working overtime while you're trying to sleep. And for many older women, this increases the risk of acid reflux, even if you don't feel the classic symptoms like heartburn. Reflux doesn't always cause pain. Sometimes it's silent, but that doesn't mean it's harmless. Even tiny amounts of stomach acid or digestive enzymes creeping up the esophagus can irritate your throat and nasal passages, especially while you're lying flat. This inflammation narrows your airway and can trigger or worsen snoring. It's even more likely if you've had spicy foods, fried meals, or anything high in fat or sugar. And yes, dairy, chocolate, alcohol, and even tomatoes are common triggers for reflux in seniors. If you want a clearer throat and a quieter night, try this golden rule. Stop eating at least 2 to 3 hours before bedtime. Give your stomach time to settle. If you must have something, keep it light, like a few slices of banana or a spoon of yogurt. And if you suspect reflux is affecting your sleep, try elevating the head of your bed by a few inches. Your airway will stay clearer, and your snoring may reduce significantly just by giving your body a chance to digest in peace. 5. Skipping your nasal routine. Let's be honest, we talk a lot about brushing our teeth before bed, maybe even removing makeup or moisturizing our skin. But how many of us pay attention to our noses? As we get older, our nasal passages change. The mucous membranes thin out. Our bodies produce less natural moisture, and chronic low-grade congestion becomes common, especially if you live in a dry climate, use heaters or fans at night, or suffer from allergies. The result? We unconsciously shift to mouth breathing, and that's when the snoring begins. Breathing through your mouth dries out your throat, increases tissue vibration, and bypasses your nose's natural filtering and humidifying process. In short, your mouth wasn't designed to be your nighttime breathing tool. Your nose was, but if you don't care for it, your nose will quietly shut down on you. So what should you be doing? Use a saline nasal spray every night to moisturize and gently clear your passages. Try a warm steam inhalation before bed, even just 5 minutes over a bowl of hot water with a towel over your head can make a huge difference. Consider nasal strips or internal nasal dilators if your airflow feels restricted. And if you're dealing with allergies or chronic sinus problems, talk to your doctor about a nasal steroid spray that's age-appropriate. Don't let nasal neglect ruin your sleep. A few simple steps can help keep your nose doing what it's meant to, helping you breathe clearly and quietly. 6. ignoring weight changes after menopause. Now, this is a sensitive topic, but it's one we have to talk about honestly. And I say this with all the care in the world. As we go through menopause, our hormones shift dramatically. One of the most noticeable effects, fat redistribution, particularly around the neck, jawline, and abdomen. You might not have gained a ton of weight, but even a few extra pounds around the neck can subtly compress the airway during sleep, especially when lying down. Many women tell me, I haven't really gained weight, just thickened a little. And that's exactly it. Even small changes in muscle tone and soft tissue around your throat can cause the upper airway to narrow just enough to trigger vibrations as you breathe, aka snoring. What's more, postmenopausal women often experience a loss of estrogen and progesterone, two hormones that help regulate breathing and maintain healthy airway function. So the body is already working at a disadvantage. I'm not here to tell you to go on a crash diet. That's not helpful, and it's certainly not safe for most women in their 60s and beyond. But what is helpful is focusing on gentle weight management that supports your sleep and airway health. That might look like walking 20 to 30 minutes a day, reducing processed foods and nighttime snacking, eating more anti-inflammatory foods like berries, leafy greens, and nuts, limiting sugar and refined carbs. In many cases, even a 5 to 10% reduction in body weight can lead to dramatic improvements in snoring, sleep apnea symptoms, and overall energy levels. So if you've noticed snoring becoming an issue post-menopause, or you've started waking up more tired despite a full night's sleep, it might be time to gently reassess your routine. Not for vanity, not for numbers on a scale, but for your sleep, your breath, and your well-being.